I suppose it is from here, isn't it? Good morning, conference. Now, giving birth to your child should be one of the best days of your life. A day when you're fully supported by caring midwives who are there when you need one. The day you go into labour is not really the day when you want to turn up at your local maternity unit and find it closed. It's not the day when you want to find yourself travelling to another hospital, maybe tens of miles away, uncomfortable and in pain, and hoping to God they've got room for you. And no, I'm not talking about some far-flung remote corner of the world. I'm talking about what's happening right here, right now, in 21st century Britain on a daily basis. But this is just one of the most shocking issues in a number of crises that's beset our most loved and deeply treasured public service, the NHS. And if you're not doing so already, I do recommend you watch Hospital, the fly-on-the-wall BBC documentary. You can still catch it on iPlayer, or at least most of it. And it lifts the lid on just how overstretched our acute hospitals are. It's a shocking eye-opener. Surgeons, highly qualified surgeons, just waiting around, unable to operate because there aren't any spare beds for patients to recover in afterwards. The most gut-wrenching decisions having to be made about which patient with a brain aneurysm that could kill them at any moment gets treatment that day and which doesn't. Patients who've had planned operations cancelled 2, 3, even 4 times when they're right outside the operating theatre door even, and they're in for the 5th time, hoping this day they'll actually make it inside. This is the grim reality of the NHS today. One patient's care comes at the expense of another's. And that's why I despair when I look at how both Labour and the Tories have messed up the NHS. It's not just the chronic underfunding, it's the additional stresses they've put on the service with unreasonable demands and counterproductive policies. 9 top-down reorganisations since 1973. That's nearly one every 5 years. The last one costing at least £1.5 billion, with few, if any, obvious benefits, but with noticeable downsides. In between times, unrealistic plans and numerous enforced targets introduced, many of which aren't based on clinical evidence, but political belief. The endless forms, admin, data collection, red tape, unnecessarily revalidation and training courses that are not the reason our brightest and best go to medical school or nursing college. And then possibly the worst ever example of a serious attempt to undermine NHS finances, the scandalous PFI swindle that's robbing our hospitals of £2 billion every year. That insane policy, wholeheartedly embraced by Labour in particular, the one that can be best summed up as buy 1 hospital, pay for 6, or maybe even 7. How dare Labour politicians have the gall to accuse anyone of wanting to privatise the NHS after they built hospitals using private loans taken out at credit card rates of interest, in the main from offshore consortia who don't even pay tax in this country. They were comprised of private investors, bankers, hedge fund managers, and big developers. Labour is not the party of the NHS. Labour's relationship with the NHS Labour's relationship with the NHS reminds me of abusive parents stealing from their children. Labour is the party that must never, ever again be allowed to run the NHS. Those 2 great men who created it, Nye Bevan and William Beveridge, never imagined either that our national health service would be allowed to become an international health service. The NHS wasn't set up to provide free healthcare to the world, wasn't even set up to provide free healthcare to Europe. It was set up to provide free healthcare to UK citizens. And UKIP is determined to put the N back into the NHS and make it a national health service once again. But let me make one thing crystal clear. No one in UKIP should ever blame immigrants for the NHS crisis, because they are not to blame. The politicians who allowed our generosity as a country and the goodwill of our healthcare professionals to be abused, they're the guilty ones, right? guilty and more. How shameful is it that our government can bail out the banks, lavish billions on HS2, spend the foreign aid budget funding the Ethiopian Spice Girls, but not invest more in the NHS? By 2020, the NHS is expected to be facing a 30 billion funding gap. Now, I'm determined to develop policies to fill that funding gap. But I tell you this, they won't involve harebrained schemes such as the one revealed earlier this week to close 19 hospitals to save money. I can't think of a better way to put additional pressure on already overstretched and underfunded staff and encourage even more of them to seek work in Australia or New Zealand, where they'll work shorter hours for more pay. It's madness to shut hospitals at a time when literally patients are queuing outside the door to get in. No, I want to focus on policies that don't just improve the health of the nation, but also improve job satisfaction for NHS workers. The NHS has suffered enough from being a political football. We need less politics in the NHS, not more. And you can call me NHS spokesperson or whatever you like, but I see my job as being UKIP's NHS champion. I want to defend the NHS, find the money to invest in patient care, and then, frankly, get out of the way. I'm not a medic. I don't have the life-saving skills of a surgeon or the diagnostic skills of a GP, nor the patience or caring skills of a nurse. So the last thing I should do is interfere and stop them getting on with their jobs. So I'll be sticking with the common-sense, responsible approach to policy making you saw in our 2015 general election manifesto. And let me remind you, that was the one in which UKIP was the only political party that could both promise an extra £3 billion a year to the NHS, plus an additional £1.2 billion for social care, and show you where the money was coming from. But I do want to go further, because £4.2 billion isn't enough anymore. It's time to divert a considerable portion of the money we spend on foreign aid into the NHS. Now, I know the fabulous Lisa Duffy was supposed to talk to you about the foreign aid budget this morning, but as you know, she's working tirelessly for the party, as she always does, to get Paul Nuttall elected in Stoke. And all credit to her for that, but you've missed out a bit, conference, because I saw her proposed speech and it was brilliant, pointing out that aid fails to lift countries out of poverty and that too much of our foreign aid is abused and misspent, wasted on fat cat salaries and sent to countries with corrupt regimes or countries with more millionaires than we have here. I think we'd all agree that at a time when seriously ill patients are lying on trolleys, when we're sending labouring mothers on 10, 20, 30, 40, 50-mile journeys to give birth, when even the Red Cross suggests the NHS is facing a humanitarian crisis, I think it's time we put those suffering in our own country first. So, while making it 100% clear that UKIP is committed to keeping the NHS in public ownership and free at the point of delivery, I will find that extra money and the resources to close the NHS funding gap. This is my priority, simply to put in place the support and infrastructure the NHS needs so it can get on with the job it was created to do and which, despite all odds, it's still doing remarkably well.
Thank you, Suzanne. Thank you.